What's up guys, and welcome to my channel. My name is Allie McCann, and since I'm new to this whole thing, before I dive into my first episode, I wanted to give a little background on who I am. I am 23 years old, I am from Pennsylvania, and I graduated from Temple University with a degree in broadcast journalism. Unfortunately, I have not been able to put that degree to use yet, considering we are in the midst of a global pandemic. So while I am living at home with my parents, I decided to give this whole thing a go. Let's get into it. Alright, so as you can tell from the episode, this is about hormonal adult acne. If you are struggling with this, you know how awful it is to try and clear up. And my biggest thing was I wanted to do anything that I possibly could before I had to start Accutane. So let me start way back in the beginning. Basically my whole life I had really clear skin, except obviously I would get one or two pimples here and there around my period that time of the month. I'm sure a lot of you can relate to that, any female actually. But back in January 2020, of course the year that can't bring one good thing into anybody's life, I started breaking out, and I thought maybe it was because I did go through a breakup, and as usual you go through all the emotions, and maybe it was the stress and the aggravation, the anxiety bringing things out on the surface. I wasn't sure. So I kind of just ignored it, but as time went on, I started breaking out more and more in here, and I never suffered from pimples around the mouth before. So I was kind of getting nervous, and as time continued to go on, they started to spread upwards, which obviously, as you know, that's the area where most people suffer from hormonal acne. Around March, I decided to reach out to my dermatologist. And right around this time, we started entering quarantine, so I wasn't able to go to his office for a visit. I FaceTimed him, I sent him pictures of my skin. His first initial advice was to start spironolactone along with a topical. And the spironolactone, basically, as usual, I did a lot of research on what I'm putting into myself, and it blocks out a male hormone that females tend to have within their body. It stops hair growth, whatever. Obviously, it takes some time to kick in the system, and they say around 3 months you should start seeing, well, actually around 3 months you should see the full results kick into place. All these months are going by, and I'm not realizing any changes within my skin. My facial lady opens up her spa because naturally I'm freaking out about my skin, which I'm not sure why, considering I could not leave the house. But she opens up the spa for me, and she gives me a couple glycolic peels about once a week, basically. And I realized that it was clearing it up in the moment, about that week, but then the next week would come and I'd have another cystic pimple. And when I say cystic, they were the very, very painful deep pimples that you get, that when you squeeze them they scar and nothing comes out at first. It was just a whole conjunction of blehness on my face. So the 3 months come, my skin has not changed. I'm still going to get the glycolic peels. And so I decided to switch over dermatologist to a girl that was in my area, and she was seeing in-office visits. I went to her, she takes a look at my face, and she's like, I guess there are 4 grades of pimples, which I had no idea about, but mine were the 4th grade of pimples, which are the deep cystic ones that you kind of really can't take care of on the surface. And that's the one thing I hate about acne, is you can spend all this money on all of these products, but unfortunately if it's hormonal, everything's got to be taken care of from within. I bought new products that were medical grade, I changed my diet, I did a lot of changes from within. But the spironolactone, which was what my other dermatologist had put me on, was not working. And so she put me on this topical cream, and she wanted me to try one more month of the spironolactone since I tried a new face wash and everything. I use it in addition to the topical cream that my new dermatologist gave me. I give it a full month and my face is the same. Like literally nothing changed. And at this point I'm starting to get really upset because I'm thinking I'm 23, I should not be having acne like this. But then she goes on to explain how acne in females is actually more common than males in your 20s. So males normally break out in their teens. Females are more prone to break out in their 20s and 30s, which is not the time in your life that you want to be having all of these things on your face. So I ended up going back to my dermatologist, and at this point I was on spironolactone, I took an antibiotic, I tried 2 different topicals, nothing was working. And she sat me down and she basically said, you know, at this point when acne is this stubborn, we look at Accutane. I don't know about you, but the word Accutane just scares the crap out of me. I was kind of upset because I'm thinking, oh my god, like I never thought in my life that I would have to be on Accutane. So I start researching all these different things and I set the date to go back for my blood work to eventually start the Accutane, which if you're not familiar with it, you do have to go through this whole process of getting blood work every single month. So I decided to research, look at other outlets just in case it decided to clear up within the next month. So I come across this thing called MORPHEUS8, which is a laser treatment, and the reason I found out about it was because my mom was getting it to tighten her skin. It's this new laser treatment that older women go to for kind of that more youthful look. But I researched and I found out more info on it, and one of the target areas for it is acne, active acne, and acne scarring. And I'm thinking there is no way that a laser can wipe this out on the surface of my skin after my dermatologist recommended all of these different treatments. I was on this pill and this topical cream and anything under the sun. So I called the lady and I'm like, look, I've been struggling with hormonal acne and I see that this laser treatment can treat that. Basically, it goes really deep in the skin and targets all the areas that are gonna bring everything to the surface. So I'm like, all right, let's do it. Nothing at this point can get worse. I'm gonna start the Accutane regardless. Unfortunately, it is a little pricey. I paid $400 a session, and normally it is more, but I only paid for the laser treatment in the cheek area since that's where my problem area was. I do have to say, after you get the treatment, your skin will purge and everything will come to the surface since it is going very deep. It does take a couple weeks to see results. So I knew right in the moment my skin was gonna purge after and I wasn't gonna see anything immediately. I am very impatient when it comes to this stuff and I wanna see everything be gone immediately. So the 6 weeks pass and I'm like, holy crap, I didn't get a cystic pimple this week. And then the next week came and I didn't get a cystic pimple again. I decided to call her up and I'm like, I don't know if my skin is just being amazing this week or what's going on that it's giving me a break from having a mental breakdown. But I haven't gotten any cystic pimples. And she's like, well, come in for another treatment because normally it calls for 2 to 3 treatments for acne scarring and active acne on the skin, whatever. So I scheduled my appointment for my second one. Meanwhile, there is about 9 weeks in between my sessions and I did not get one cystic pimple. But there were still the hyperpigmentation, post-inflammatory acne scars on my skin. At this point, I'm super excited because I was about to start Accutane, and when I realized I wasn't getting any of these cystic pimples on my face anymore, I called the dermatologist. I'm like, look, I'm gonna push this off until the end of summer because one of the biggest things about Accutane is you're not allowed to go in the sun because it does make your skin super sensitive. So I was just super pumped because I'm like, if I found an alternative to not having to go on Accutane, I am going to be the happiest person in the world. So I hopped in my car off to my second appointment with LMG Cosmetics in Scranton, Pennsylvania, and they were nice enough to let me bring in my vlog camera and document the whole thing during this global pandemic, as I mentioned before. But I did have Amanda kind of explain the whole process of what Morpheus8 is, what it does to the skin. I documented me getting the procedure done, so let's take it away. Okay, so I just pulled into my appointment for my laser treatment. Obviously, I don't have any makeup on, but I did want to show you guys exactly why I am getting the laser treatment done. I'm not sure if you'll be able to tell through here, but if you can see, I have a lot of post-inflammatory acne marks, a lot of pigmentation, which if you do suffer from this, you know how hard it is to get rid of this. This is my second laser treatment. I was told I would only need 2. So with that being said, hopefully after this one, it will be the final results. Stay tuned.
Hi guys, Amanda with LMG Cosmetics. We're doing a Morpheus8 treatment on Allie. So Morpheus8 is radio frequency skin tightening, okay? So this is a handheld device. It is 24 coated needles, great for all skin types. The needle is variable, so it could go down deep 4 millimeters, and it will deliver that radio frequency hot energy to give you that instant skin tightening and collagen production. So it goes 4 millimeters, 3 millimeters, 2 millimeters, and 1, hitting every layer of the skin. Not only will you have profound collagen production and skin tightening, but you will also have a significant change in skin texture, tone, discoloration, large pores, acne scarring. You can even get rid of stretch marks, cellulite, etc. This is Allie's second treatment, and we are doing this, she's super young, but we are doing this for the treatment of acne and acne scarring. And also just overall better skin, and just prevention of, you know, because obviously, as Jane Fonda would say, if it's not broke, fix it before it is.
Yeah, I'm gonna be honest, it is extremely painful. As you can tell, my skin is very red right now. Unfortunately, you don't see results until about 6-7 weeks after you get the laser done. So I just wanted to give you guys a peek at what it looks like as soon as you do a treatment. Not too appealing, but yeah, stay tuned and I will show you pictures and videos when I start healing. Good morning. It is 5 days post laser treatment, and I wanted to give you guys kind of a few days after update, basically a week after. As you can see, there are, well, it looks like there are scrapes all over my face. There are scrapes all over my face. It looks like I fell off my razor scooter and scraped it down the concrete. Like I mentioned, it is gonna take the full 6 weeks. However, when the scabbing does heal, I will definitely see lightment on the hyperpigmentation marks that were there. But I promise you guys, it is worth the time, the pain, and the money. Guess what? My face is officially pimple and hyperpigmentation mark free. So it is 4 weeks post Morpheus8, and I know it's not the full 6. Obviously, I am not completely clear, even though I feel like I look completely clear compared to what I started with months ago. Here's a little update. I am so happy with the results, and I hope that this whole journey and laser treatment story of where I came from to where I am now has inspired somebody to go out and try it and try and heal their skin as well. I understand that my acne is nowhere near as severe as some people out there, but I know that there are people who suffer with minor hormonal acne, and you are not alone. Thank you for watching. Be sure to subscribe and like the video, and come back to my channel for more videos like this.